Okay, the Prime Minister apologised yesterday for the slow rollout. As Health Minister, will you do the same?
Yes, absolutely. And obviously we would have wanted to have met those early targets. Our goal was to have 1 million a day now, and so I am sorry that we weren't able to do that. 1 million a week now, I apologise. I am sorry we weren't able to do that earlier, but we are achieving that 1 million a week now. The decision to reduce the recommended volume of people from 20 million who could have accessed AstraZeneca to just over 5 million as the recommended and preferred group, that had an impact. There's no doubt about that. And however, what we've been able to do is adapt. Our goal, as I say, was to be approximately 1 million a week at this time. That's what we're doing. Because of that change, it took us longer to get there. But throughout the pandemic, what is it that's marked Australia? It's our ability to adapt. Why is it that the loss of life here is so profoundly lower? Because we've adapted very quickly, whether it's on the economic, people in Victoria can come forward for their disaster relief payments, whether it's on the health front, but always we're looking to achieve more. And so, am I genuinely and deeply sorry that we weren't able to hit those initial targets? Yes. Am I pleased and profoundly pleased that we're doing 1 million a week now, 184,000 yesterday, and saving lives on a scale that virtually no other OECD country is doing. That is the ultimate test, saving lives and protecting people's jobs.
Okay, you mentioned there that you are distributing 1 million doses a week. Why can't 27,000 disability residents be vaccinated in 5 months then?
Well, what we see is that we've had over 3,700 visits to disability residences. We've now delivered, I think, over 24,000 doses to disability residents. And so we are encouraging and working with them and making sure that we're doing these in-reach visits. So, as I say, over 3,700 visits, 24,000 doses.
Yeah, but in terms of percentage, sorry, Minister, it's still less than half, though, haven't received that first dose. And that's in the 1A group.
No, that's
despite
not
warnings.
Correct. That's not correct. At this point in time, it's approximately 57%. And we're always encouraging those groups to take it. We're working with them, we're building confidence in the vaccines, and we really thank the families who have supported either the in-reach visits or the visits to the GP or the specialist disability hubs, and we'll continue to build that confidence and continue to provide that access. So if you do have a son or a daughter or a family member with a disability, we urge you in the strongest possible way to provide that consent, to provide that support, because it could save their lives and it could protect the lives of others.
But there's still only 1/3 that have been fully vaccinated. Going back to my point there, it is Group 1A, our most vulnerable. Surely it's not acceptable that thousands still haven't been vaccinated properly.
Well, we're always working to encourage and to ensure people do take up the opportunity to be vaccinated. And as I say, we have the disability hubs. We've had over 3,700 visits. And indeed, we're continuously providing those in-reach visits. And so in the same way that we were able to vaccinate 100% of aged care homes, and that has made a profound difference during the Victorian and Sydney outbreaks, we are continuing to vaccinate those with disabilities, and as I say, 24,000 doses in that population of 27,000, and always encouraging the families to either bring their loved ones forward or to ensure that they are providing consent.
Okay.
But that community is doing a great job, and I want to thank everybody for coming forward in record numbers, but continue to encourage them to do so.